Greetings everyone, my name is Shireen Brown and I'm a business analyst at the Public Health Informatics Institute, part of the Task Force for Global Health located here in Decatur, Georgia. I'm working on an absolutely amazing project related to the control, eradication, and elimination of neglected tropical diseases. A neglected tropical disease, or NTD, can be viral, parasitic, or bacterial. These diseases disproportionately affect the world's poorest, those who live in slums, without access to clean water or sanitation, or in conflict zones. These diseases, by definition, are diseases of poverty. Children stand to suffer the most from these diseases, according to the World Health Organization. About 1 billion of them are affected by NTDs. That's nearly 1/7 of the world's population. However, because NTDs are diseases of poverty, it takes a shockingly low level of resources to make a drastic change in the lives of those suffering, which means that control, elimination, and even eradication are within our reach. And that's what the end goal of this project is. I'd like to walk you back through a bit of history. Way back in 2011, the WHO launched a roadmap to 2020, setting goals for elimination, eradication, and/or control of the world's most devastating NTDs. In January of 2012, members from all over the NTD community came together to identify 10 of those 17 diseases with the most urgent need. This collective support of organizations and institutions across the NTD spectrum became known as the London Declaration. However, the community still lacked a unifying body to help achieve these goals. Uniting to Combat NTDs, a coalition of partners and institutions from across the NTD spectrum, was created to drive towards achieving these milestones. That's where PHII comes in. Under a grant from the Bill and Melinda Gates Foundation, we're working with Sightsavers, a UK-based nonprofit, to serve as a support center for Uniting to Combat NTDs. Each year, we'll produce an annual scorecard tool that measures the progress towards eradication, elimination, and control of those 10 NTDs. I serve as the data manager for the scorecard. My primary role is to gather and analyze data so that scores can be generated. On a parallel path, PHII will also design and develop a web-based system. It'll be used to streamline data gathering and analysis and help produce better future scorecards. Ultimately, this system will ease passive communication between different organizations providing data. It'll serve as a central repository for all of this information and eventually track the outstanding progress that the NTD community has made with a variety of interventions. It will also highlight where more hard work needs to be done in order to improve the lives of those suffering from NTDs. We have a meeting coming up with stakeholders within the NTD community to define the functional requirements for this system and how it should work in the future. Ultimately, PHII will be joining a cohort of other groups here at the task force that are working so hard in the fight against NTDs.